Chairman sir, good evening.
Good evening, Dr. Mangesh ji.
National President will be joining in 5 minutes time. Already there are almost 30 people joined. 30 possibly. We are expecting more. So in 5 to 10 minutes, Dr. Harish Shetty also has joined. So we request to wait for another 5 to 10 minutes, sir.
Mangesh bhai, good evening.
Good evening, Chandraj bhai. How are you?
Yes, fine, sir. It will be very interesting. Today's topic is also interesting.
Yeah. Chairman sir, just see whether a president sir is joining. Sharat?
Please wait.
Yeah. Dr. Shetty, National President is joining in 2 minutes time. Just let us wait for a few more people are joining.
Connection lost. वो पिक्चरवा कहाँ कंप्लीट हुआ?
नहीं कंप्लीट हुआ, उसको देखते हैं लास्ट एंड क्या हुआ।
Good evening, friends. Dr. Mangesh Patel here. Our National President, Dr. J. Jayalal, is joining in short while. Chairman sir, Dr. Jayalal is joining in 1 minute time.
Yeah, we should wait for
Yeah.
National President.
Yeah, he's coming, sir. Shetty sir, we welcome you on the dais of IMA Hospital Board of India. I will introduce my chairman, Dr. Sharat Agarwal.
Thank you.
Yeah.
Mangesh.
Welcome, Dr. Shetty sir.
Welcome.
Thank you.
National
Mangesh.
President, Dr. Jayalal has joined. Welcome, sir.
Welcome. You are looking like a soldier. Something is different kind of.
Something different.
Yeah.
Okay. Shall we start, sir?
Yes. Our HF, finance secretary is also here.
Okay, sir. Okay.
He will also join after that. Just
Okay. Good evening, all. Welcome to this fourth webinar, successive webinar of IMA Hospital Board of India. Respected National President, today Secretary General is not there, he's in the flight, get called. Our Finance Secretary, all office bearers, various IMA leaders from all across India, Chairman Dr. Sharat Agrawal sir, all senior leaders and friends. We have a guest speaker today, very eminent personality, Dr. Harish Shetty over here for today's webinar. And before going ahead with the proceedings, I request our National President, Dr. Jayalal sir, for his presidential address. Finance Secretary Dr. Anil Goyal, welcome sir.
Anil Goyal boss, namaskar.
Namaskar. President sir, your presidential address sir.
So thank you, the Sharat Agrawal, my good friend, and the Secretary, Dr. Mangesh Pandey. I know for sure that our Secretary General is on the flight. So thank you very much for this program, and we are continuing doing it every week. Today is a very important day as you are doing a program on the communication skill. And one of the best expert on the communication skill is invited as a faculty for this program. I'm sure that is what is going to be the most needed thing for every practitioner of this country, that we need to how to communicate with the people. I remember one incident where a patient came with a abscess in the pulp space in the finger. He came to me. I said, yes, it's an abscess. I have to do a AND. He said, no, sir, I don't want to do the AND. He went away. The owner of the hospital is a general practitioner. He talked with the patient, and after some time, the patient came back, sir, please do the surgery. Now, I asked him, what is the importance, sir? And he said, I have talked in the language which the patient can understand. It is not that how much you are familiar with the new things, but you must communicate with the people in the language in which the patient can understand. That a general practitioner can do that, but we most of the time, the specialist and the super specialist, we forget that that component of the patient, and we talk in our language which is not communicable to the patient. So we need to understand the importance of communication skills. I often used to say, quote an example of a thyroid patient. If a patient comes with a hypothyroid, if he asks the question, how long I have to continue the treatment? There is two ways of expressing that. One person, doctor will say, till you die, you have to take the thyroxine. Another person will say, till you live, you have to take the thyroxine. Both are same meaning, but it has a positive and negative feeling on that. And how best we will be able to communicate in a positive sense to the patient is the most important thing in this era. As we talk about the most of the issues which are faced with the medical practitioners, most often it is a communication is what is the most important thing, which is determined whether we are going to settle the issue with the patient or we are going to settle the issue with the court. The people, doctors who are not ready to spend time for communication has to spend time in the court to settle the issue. So I am so happy our Hospital Board of India is organizing a program, especially with the communication as a most important tool to be adopted by the practitioners. I'm extremely thankful to that. And I know for both Sharat and Mangesh should be happy. As a national president, I'm extremely happy. Hospital Board of India is rising to up the occasion and weekly conducting this program and doing the good job to the society. Thank you very much, both Sharath and Mangesh. Keep it the tempo and let us do something good for the society, and we will be able to stand up to society. I am sure the talk today on the communication skill definitely empower our people, empower doctors to help them into how to communicate the things appropriately to the patients and get benefit out of that. Thank you very much, Mangesh, for this opportunity.
Thank you, President, sir. Our chairman, Dr. Sharad Agrawal, sir, you want to express a couple of words before we start?
Yeah, respected National President Dr. J. Jayalal, sir, as HSG is in flight, respected Finance Secretary Dr. Anil Goyal, sir, leaders of the IMA and HBI, and dynamic Secretary of HBI, Dr. Mangesh Pate. On behalf of HBI, I welcome you all. I welcome the very learned speaker of today's talk, Dr. Harish Shetty. And without wasting time, I'll invite Dr. Shetty. I ask Mangesh Pate, sir, to please proceed with the session.
Mangesh, you can ask our HFC. You can also talk from here because he is with me right now.
Goyal, sir, will you like to address?
Thank you. Thank you, Dr. Sharad, Dr. Mangesh, and thank you, esteemed speaker and esteemed our president. Also, everyone who is present here. What I would like to say that communication is 7% is only verbal and 93% is non-verbal. I think the speaker will tell about this more. And what kind of verbal, as Dr. Jayalal said, whether it is with empathy, what is your tone, what is your tenor, what is your posture, everything includes the verbal communication. And suppose you are sitting in a posture like with your legs relaxed and back on the seat, then possibly patient will understand that you are not taking him seriously, or you are not listening him seriously, and he will not be happy, or he will not be contented that you have seen him in a proper manner. So only thing I would like to add is that verbal communication is only 7%, 93% is non-verbal, and we need to concentrate on both. Thank you, Dr. Mangesh, Dr. Sharad, and our dear president to give me this, to allow me to speak in this illustrious forum. Thank you very much.
Thank you, sir. Thank you, sir. Friends, before going to our proper webinar talk today, usually I like to restrict the introduction part. But let me tell you, I know Dr. Harish Shetty for years together. But because of this webinar, when I officially asked him for his CV, and when I went through his CV, I found many things which I never knew before. And I definitely will like all of you to know about Dr. Harish Shetty with this very specific thing. First of all, he is a practicing psychiatrist, very eminent psychiatrist. He has got extensive experience in the field of mental health, especially in connection with the diseases. He has worked in the earthquake in Latur in 1992-93, in the Kandla cyclone, in the Gujarat and Jabalpur during earthquakes. He has worked extensively for the youth.
Every possibility, Prime Minister will address to us.
Sure.
Talk with the VK Pal.
Hello. He is the governing body member of the NTA appointed by the Government of India. He has immense experience in the school mental health and has conducted hundreds of workshops for students and teachers. He has aided the rights for the children throughout his life. His petition with the Maharashtra Human Rights Commission, this is very important, to abolish the segregation practiced in the schools, that is the separation of the children by virtue of the marks and dumping those who have got lesser marks as a separate category or in a separate division. His application was taken suo motu cognizance by the High Court, and this system of segregation was abolished. Such a huge and tremendous and hurricane work by Dr. Shetty. A letter sent by Chief Justice of Bombay High Court also was taken in suo motu and segregation was abolished. His petition in Bombay High Court in 2015 on learning disabilities has facilitated a starting of a learning disability detection center in the every district in Maharashtra state. He has worked extensively in the suicide prevention. Dr. Harish Shetty has been training the judiciary. This is very important. He has a tremendous contributions in the Afghanistan through NGO in the medical fraternity. He has been a trainer at various parts of a judiciary in Bhopal, a juvenile justice, the training center. He is a distinguished faculty of a Symbiosis Law College, Pune. He has been appointed as a member of a national testing agency by the Union Cabinet on behalf of the HRD Ministry. And he is there a trainer, researcher, avid blogger. And above all, he is a great orator. So today's topic, which carries very important, grave importance on the background of the healthcare violence for which we have been fighting. So the topic today, communication skills. I invite Dr. Harish Shetty. Over to you, sir.
Namaskar, everybody. I'm so happy to be here. Namaskar, President of IMA, Secretary for the Hospital Board, and the Chairman. Honestly, the medical field in India is at crossroads, and I don't want to go into that at all. But what is very important is that we are fighting not many battles, but we are negotiating at different systems, at different levels to maintain the dignity of the profession and to see to it that the activities of our professionals are smooth and clean. Having said this, I would like to also say that communication is not about individual. It's about systems. It's about the entire infrastructure of the hospital, which is very important. Sometimes you hear, doctor is very nice, but the nurses are very rude. The doctors are very nice, but the billing clerk made a big mistake. So it's all about systems. First of all, let us understand the context. There's a rapid social change happening across the country. The number of people in the funerals have gone down. The number of people meeting each other has gone down, not in the pandemic, but much before the pandemic. Angst and mental illness is very high. Let me tell you, in 2019, December, the Ministry of Welfare, Health and Welfare, and ICMR released the data for the mental ill in India. And they said 1 out of 7 Indians are mental ill, 20 crores are mental ill. And the angst on the roads, the angst in the trains, the angst at so many places is so big that I'm not surprised that the weakest link, the doctor and the teacher, are attacked more often. We are poor advocates of our issue, though now Dr. Mangesh, our president and others have made inroads and have been advocating for the rights of the doctors at different levels. We are a divided house, and that also is a very big issue. And what is very true is the society is disconnected. The doctor on this side of the street does not meet the doctor on the other side of the street till there is a havoc. Peacetime initiatives are so important to prevent violence. Peacetime communication is as important as what we do when there is an anticipated violence or a violence. I always tell my patients, all those patients who follow up regularly, who never miss appointments, have fewer relapses and fewer hospitalizations. And that's a metaphor I would like to use. Disconnection is the truth in globalization, where a security guard and a CEO work more than 12 hours. We don't meet each other, and we mate less than what people mated 100 years ago. And that is the truth. Disconnection is worse than HIV. And when I start talking about communication, remember, the first thing is, what are you communicating to yourself? As a doctor, what is your self-talk? What are the sentences that move around in your mind? Oh my God, I have to finish my EMI at the earliest. My God, I have to also finish the EMI of my hospital and my house. I need to marry my daughter. My son may not get into a merit seat. I may have to spend for him. A lot of self-talk happens automatically, but remember, be aware of your self-talk. You can change your self-talk inside your mind. What you tell yourself every day in the morning as you start for the hospital is very important as what you share with the patient in the first minute. Research has shown that what the first sentences to the patient is much more important than all the explanations you have given much later. So what you say to yourself as you start the day, I will do my duty to the best of my ability. I will see to it that every patient is attended as well, as much as I can. And I'll come home and see to it that I'll spend time with my family and I'll rest adequately. And as I sleep, sentences move in my mind across the day. My God, I should have really looked at the appendix a little more carefully. I missed that appendix which burst inside the stomach. I should have actually palpated the liver a little more than asked for an ultrasonogram. And these things are very important, because when you're aware of these things inside your mind, you correct them automatically. The self-talk is extremely important. Number two, self-care. You cannot have good communication skills without taking care of yourself. An angry doctor is a stressed doctor. An irate patient is also a stressed patient. Extremely important, come what may. I understand that work-life balance for a doctor is very difficult. There's nothing like work-life balance. Imbalance is the truth. Finding balance in imbalance is important. So whatever it is, self-care would mean I try and make myself free for 1 minute of breathing between two patients, 5 minutes of breathing between 5 patients. I also try and exercise as much as I can, or as short as I can. I share my feelings every day with my colleagues. I pick up the phone and say, my God, I did not know what happened today, but I missed a clear case of malaria. No talking about glories. When you share glories, there is no self-care. When you share failures with honesty, courtesy, and candidness, you improve as a human being. Self-audit. I started my practice 5 years ago. Where have I reached? No, you don't talk about EMIs alone. You don't talk about your house alone, but you talk about what is the care. Are you satisfied with the care? Are you satisfied with your communication? Does your communication connect with the patient, or it just remains in the space between you and the patient? Is your hospital staff communicating as well as you do, or you do not pay much attention to it? Auditing your work across time improves many parameters, and one of the most important parameters is your joy. Remember, you cannot be joyous superficially at all. Wearing a 3-piece suit is not joy. Becoming somebody in any association is alone not joy. Auditing your work very genuinely is important. And also self-growth is the realization. Do you talk to yourself? Are you in touch with your feelings, thoughts, and emotions? Are you in touch with your behaviors? As Shah Rukh Khan said, खुद को खोने से पहले खुद से मिलना चाहता हूं. हम अपने आप को मिलते हैं क्या? Do we talk to ourselves? Are we aware of ourselves? Is something which is so important. So communicating with self is the first level communication in terms of communicating. Now, communications are systems. It's not individuals. What is the philosophy of the organization as people perceive? Hospital is very nice. They're all very kind. At the entrance, they smile at me. As I enter the ward, the nurse, though she talks in broken Malayalam, she has a beautiful smile. And when I press the bell, most of the times they reach me. And when I ask them, what is the illness? They tell me what the illness is. The philosophy, define the philosophy of the organization. What is the character of the entire organization? Well, I had no money at all, and I did not know what to do. And this doctor said, you can pay me as and when you can. I could see kindness and compassion as their character. Come what may, this doctor might make mistakes, but one thing is there, he's honest. And the perception of the philosophy of the organization, the perception of the character of the organization is more important than your skill base, but the skill base is also very important. What is your skill base? Are you growing? As I said, in practice, you need 5 A's, and the 6th A is more important. 5 A's, one is whether you're affable. Second is whether you're available. Third is whether you're accessible. Fourth is whether you're affordable. And fifth is average skills is enough to do well in life. But the fifth and the 6th is awareness. Awareness helps you to improve your skills across time. So what is important? The skill base has to improve. The mistakes I committed a year ago may not happen in this year, but I learn every day, and I learn one day at a time, and that is so important. The fourth perception of the people of your organization is, are you a mercenary or a missionary? I will not release the body till all the bill is paid. I will not cut a penny of your bill. This fees is mine. I don't know. I'm not saying that you have to sell yourself cheap. I'm not saying that you need to do only charitable. I'm saying that you can charge your fees, what you have defined, but take care of the patient. When you take care, you become a missionary. When you communicate well with your fee structure, you are a missionary. But when you communicate badly, whether you want to come here or no, it's your choice. This is the choice. This is the one which I will charge for a cholecystectomy. And as our president said, this medicine is till you die, and this medicine is till you live. If the people perceive that you are a mercenary, they're going to get back at you at some point of time. So your perception as a missionary is very important. And number 5, it's your tagline. How do people describe you? I would still say there was a hospital close to my house as a child. I would not name the hospital. They would say, Udar jayega to upar jayega. If you go there, you're going to go up. And this tagline is defined by the people at large with a whole lot of experiences. But you can change the tagline by changing the philosophy of the organization, changing the character of the organization, and also changing the skill base. So what is your tagline? Find out from people, how do they describe your hospital in one line? And that will give you a feedback of exactly who you are and what you are. The next important thing is, are you a patient-based doctor or a people-based doctor? Patient-based means I'm in the clinic, I'm in the OT, and I go home. I do not know anybody between my hospital and my house. I have not addressed a bunch of patients free of cost. I have not addressed a bunch of patients in my locality. I have never gone to my slum and addressed preventive aspects of diarrhea, preventive aspects of infection. I do not believe in all this. I do not believe in all these gimmicks. Not at all. A people-based psychiatrist or a people-based doctor is a better communicator because he interacts with people all the time and communication comes very naturally to him. All those doctors, once in a month, they address 500 patients. They address 1,000 patients. They address normal people, 500 people. They take an initiative to go and talk. I will share you an anecdote. One doctor asked me, a surgeon, I've joined a corporate hospital, but the marketing department is not promoting me. I do not know what to do. I said, remember one thing, my dear friend, you grow with the hospital grows with you. But the hospital grows in spite of you and you grow in spite of the hospital. What do you mean, he asked me. I said, who stopped you from going across to the school and telling the principal, I want to talk to 8, 9, 10 standard kids of how does the food gets absorbed in the stomach in a manner of a storyteller. A good doctor is a good storyteller, and that comes only by practice. It's not that I am very creative and he's not creative. Each individual on this earth is creative. Few discover it in their lifetime. So people-based doctors are better communicators. Patient-based doctors are good at sharing evidence. And evidence is only meant in the classroom of doctors in an IMA talk. But even in an IMA talk, you have to be a better communicator. So very important to understand whether you're patient-based or people-based. Please become people-based doctors also. Well, branding happens incidentally. I do not believe in planned branding. Well, the word good human being is being misinterpreted across time. Well, when I was a child and a young boy, my father said, be a good human being. When I joined medicine, my father said, come what may, Harish, no patient should leave your clinic for want of money. Be a good human being. But now, if you say a good human being, that means you have no opinion. You say yes to everybody. You don't stand up for a cause. And you don't rush to the hospital of a doctor which is being bashed by a mob. You go only for the funeral. You only send condolences. Good human being is that person who's in the train, he sees a bomb across and he says, bomb, you do your work, I'll do my work. No, I do not want good human beings. I want effective doctors. The difference between good and effective is very small. Good, I have no opinion. I will play safe. I'll remain in my cocoon. I'll take care of my family. An effective human being means every doctor is my brother and my sister. I will not criticize anybody without reason. And if there is a reason, I might go and tell him, but I will never criticize him or her in front of anybody. Because when I criticize him or her, you are hitting your leg with an axe, because people lose faith in all doctors. You can pull somebody's ear in private and slap him also. But what is important is you need to respect. Doctors can make mistakes, but doctors are not criminals. So soft and strong, good. He's soft, but the ek baat hai, yeah? If he loses it, no, he can go and do anything. Having a little repetition of you can also lose it is effective in the 21st century. He's a good man, but he will not tolerate any nonsense. At this point of time, I would like to share my personal story. In the year 1993, I was 30 plus, 1 or 2. I was told that I should pay 10,000 rupees for some goons in my area where I have a small hospital. And they said they're going to have a celebration of a historic figure on his birthday. I said, I will do what is good in that entire activity. They said, we're going to have a painting competition. I said, I will bring all the colors and the papers. Don't worry at all. They said, no, 10,000 rupees. I said, no, I will not give you. And I said it very nicely. And I told him, I know much more about the historical figure than what you all know about him. And I was very kind. I was very peaceful. I did not prevent any interaction, and I met them many times. But one day they beat up 2 patients who were entering my hospital. And I lost it because my belief is I will stand with the law. I will file an FIR. I will not run away. Come what may. People may be with me or people may not be with me. I will file an FIR. I took my 100cc Kawasaki Bajaj bike. I ran to the police. I said, extortion ka case hai. Please arrest these people. He said, I will send a constable. I said, no, sir. Please send a jeep with an inspector. I did not know anybody. I was just young in practice. And all the boys were arrested. And at night, I got a lot of calls from the parents. I know why they called me, because they did not want the diary to be written. They did not want the FIR to be filed. And they wanted me to come to the police station and say, please forgive. I did nothing of those. And a FIR was filed. I was threatened for 2 days, but then the area became calm. All extortion in the area stopped, because I have a belief, and every doctor has to have a belief. Don't let down others. When you don't file an FIR, you're not letting down yourself. You're letting down the entire community. And that, I think, is very important. So be soft and be strong. Be effective and bold. India needs effective people. We are no longer on the fence. 40 years after independence, we were on the fence. Aisa bhi 50-50. No, we take decisions. We are bold. We talk our mind openly. Soft and kind. Yes. Even you're effective and bold, you're also kind. But just being soft and kind, you'll be exploited. That's not the way. I would say soft and strong and effective and bold are the best ways of communication. Can we change our nature? Everybody asks me, Dr. Shetty, you're saying you should be effective and bold, but I can't change my nature. My nature is my genes, my upbringing, my parents, my circumstances, and all the things I've heard as a child. And you are a psychiatrist, doctor, you know the best. A child develops because of experiences, because of genes, because of nature and nurture. I can't change myself to be effective and bold. I said, no, you may not. Actually, you cannot change your nature, but you can start changing it little by little. That would not mean that you will be changed. You can change your nature completely. But remember, to be effective communicators, we have to be different avatars. Different avatars. With a cognitive patient, you have to give him a lot of data and links. Where 85% they operate, they felt like this, and 25%. With an emotional patient, you should say, don't worry, I will try and do my best. I am very, very effective as a doctor, and I feel for every patient, and I'll do my best. With a cognitive patient, again, what I've said earlier, then with an obedient patient. Obedient patient, they look for your blessings and your wishes all the time. No harm at all, please give it. Because people need to see different types of doctors. Actually, if you look at the waiting room of the clinic, you can describe the personality of the doctor. But we need to play different avatars. And there's a paranoid patient, be careful. The best way to deal with a paranoid patient, you may go to any doctor outside this clinic and feel free to choose your doctor of choice, and they come back to you. And it's very important to understand that we cannot change our nature, but we can slowly change our meta nature, the small natures, and move towards the belief that I have my beliefs. I want to be honest. I will share my educational knowledge, but I will never share my wallet. And I will learn to play different avatars at different points of time. So in communication skills, there's one rule. What happens to your son who says, I want to buy iPhone 11, daddy? And the doctor feels that it's not necessary, even if he has money. And some doctors will feel, I don't have the money, I can't buy it. How do you say? You don't say, hey, you study and then you'll get it. Or you don't say, you are really arrogant like your mother or like your father. No. You can say, you know what? I understand that you need it, but honestly, I can't afford it. I feel sad when you make unreasonable demands. When you share feelings, there is bonding. When you share adjectives, there is displacement and there is a schism in the relationship. And so sharing feelings brings bonding. I still remember 2 days ago, I was late in my clinic in a hospital, and 2 patients were very angry. They said, you don't respect my time. Dr. Shetty, I'm very upset. And I did not tell him, I did not brush that thing off. I did not tell him that I had an emergency. I did not tell him that my car broke down. I said, I got up late. I'm so sorry. I'm so upset that you feel sad. And I promise you, I will not do this again. I'll try my best not to do this again. And I'm sorry. Sharing feelings brings bond. It's not a sign of weakness. Many people say, if you share feelings, they'll sit on your head. No. In peace times, you need to build bonds. Patients may not improve, but patients should say, I still remember this great doctor, Dr. Sagade, late Dr. Sagade, one of the best urologists in the country. He passed away recently. And the patient would say, even if the patient died, they would say, Dekho, mera patient, he died, but let me tell you, he's one of the best doctors we have ever met. And that happens when you're honest and when you share it. Adjectives break relationships. Oh, that fellow is from that hospital, MS. He's a barber, man, doesn't know what to do. Finished. And that patient, my God, you see, I'll tell you, I'm very angry at the fact that you left your close relative on the bed and you went out for 2 hours. You know what would happen? Not adjective. I'm angry at you is normal. Patients love to hear, I'm angry at you. In India, when you say I'm angry at you, they feel you love them. You're very close to them. And that's important. Sarcasm, no. And in communication, what is very important is sharing feelings. Now, what happens to doctors? I do not share feelings. I'm a stoic doctor. I'm an evidence-based doctor. I'm an introverted doctor. Oh, well, you may be introverted. And my parents did not share feelings. They did not hug me. They didn't say, I love you. I've never said I love you to my parents. It doesn't happen. I say, start. There's a place to start. And if you start, you might write a new program on your DNA and your children may be different. Every era has its problems and every era has its own solution. Sarcasm also is a very bad way of communication. In the front office, SOFT is a good acronym. Slow communication, open-ended statements, feeling phrase, yes, the doctor is late because his operation has extended by 1 hour. I'm very sorry that you have to really wait, but let me tell you, I'm helpless. Training. Doctors spend lakhs of rupees for a fellowship. Doctors spend a lot of money for their personal joys. Doctors spend a lot of money in their organizations, but they never spend on training of the people in communication skills. Soft skills, not important. My God, the girl or the boy at the entrance on the front office defines your character, defines your fitrat. And you will not spend money on that. So stupid we are. And that is not the malady of doctors. A lot of in a country, we spend money on things which we can see. Oxygen cylinders, instruments. We buy expensive instruments in a hospital and we don't train our front office guy to talk to you in a very compassionate manner. Isn't that a paradox? Well, and that is so important. Now, let me tell you, in the COVID era or even other eras, the resident doctor called me and said, there is an emergency, you immediately come, huh? There's something happening to your relative. A senior resident said, no, it is the oxygen, and the resident said, oxygen 85. The senior said, it's 90. HOD calmly says, no, it's not like that. This is what it is. There's no need for you to come. You can stay. But the HOD and the dean did not spend time to train your resident doctors in communication. We as MBBS, in our MBBS, have never been trained. And even now, training is very superficial. Though induction phase, as advised by MCA, you have a long training period, but most of it is tick marks. And when you train for communication, you don't teach them, you unlearn and let them learn all over again. A lot of workshops, a lot of trial sessions, a lot of psychodrama, a lot of real life situations. HODs and deans will never train this. And these same residents become consultants and they become big doctors. Now, is PR communication? Ask yourself a question. We have a PR girl. If somebody comes for an open heart bypass and the patient goes back without operating, you have a gentleman or a woman who chases that patient. Or do you think we need to have an appointment again? Do you have any issues with the hospital? Do you think your cost is very high? You can bring down the cost. Is PR communication? No. PR is part of the communication, not communication. But the PR guy has to be the buffer between the doctor and the patient, and he or she should be the eyes and ears of the doctor and communicate to the doctor, this patient is actually exactly unhappy because you spoke to him only in one line, and in half a minute you explained to him the diagnosis. He wants to ask you a few more questions. Would you actually do that? And this PR people inside the hospital should be the eyes and ears of the doctors. Even a small nursing home, the frontline staff is also the PR guy, and they need to be trained to understand what makes the patients happy and unhappy and correct that much earlier than what they should actually do. Now, visibility of the doctor also is a communication, is a communication medium. Are you the face of the IMA? Very good. But that's not enough. You may be respected by all of the doctors. They might love you because you really are a good doctor, apart from you being a great human being and an effective human being. But you need to have a public face. You need to be writing about your subject. You need to be actually writing or talking about your subject. A lot of doctors have melas of talks to common people, and that does not cost, that does not require time, that only needs an inclination. And where there's an inclination, we have the time, HMT at. And that I think is very important. Do you have a media face? Of course you need to have a media face. And media face where you educate. Education is one of the biggest marketing tools for any doctor. Do you have a community face? Yes, there are communities. In India, there are full of communities. There's one community of one caste, other community. Are you seen visibly educating them? There's a Wagad Association, I go every year. And it spreads. The power of the whisper is much more stronger than the power of the social media. Don't overestimate the social media too much. The power of the whisper is much more stronger. And it's more common in villages and towns, but it's also common in cities. When you talk to community organizations, do you have a community face? Do you have a political face? There are certain organizations which call the minister of that area every time when they have a conference. They photograph themselves with the ministers. Well, such photo ops, such positioning may be important to educate the minister about the issues facing the doctors, but the people also feel very strongly that these doctors want the betterment of the patient, and they would reach out to all stakeholders so that the patient care will improve. Do you have a religious face? No harm at all. No harm at all. I mean, if you are seen in religious organizations educating people, I've been to every denominator across the country, name it. Recently, I had a talk for the Archdiocese of Bombay. I had a talk with a different religion, groups of different. Nothing wrong. Please go, because we are potatoes. A potato is a vegetable which merges with every vegetable. every non-vegetarian dish retains the taste and enhances the quality of the entire dish. Doctors have to be potatoes, and potatoes is one of the best metaphors for any doctor. So have different faces, and that's also communication. Communication, not only what you talk to the patient, it's a big system which we need to take care. Well, beware of ghettos. Any ghetto where people stay close to each other. It's a tight community. They would not want anybody else to encroach that community. And they generally come in groups to the hospitals. Be smart enough to ally with the leaders of such ghettos so that you can educate the people about medical illnesses, prevention, and the easiest modes of treatment. Repeat offenders, be careful. And doctors will not repeat offenders if they communicate with each other. If they're isolated and divided, they will not know. And in the mohalla, if there are 10 hospitals, 20 doctors, if there's an event, even a small event, inform, share, and find out who are the repeat offenders who trouble the doctors without reason. When the patient is with too many carers, emotions run riot, reason falls. And that's the time when there's cognitive distortion. Doctor went to the OT, and he came back after 4 hours. Something must have gone wrong. That's a cognitive distortion. Doctor came out of the OT, but he never smiled. Oh, something has gone wrong. It's a cognitive distortion. Doctor walks out of the ICU and never meets the close relatives. We have to run after him. Why the hell? The more serious the relative, the more the communication. The bigger number of carers, the more the communication. Be careful of communities which use only violence as a weapon of communication, and be careful of criminals also. So what is important? Communication, repeat communication, recurrent communication, persistent communication, and persevered communication, but the same communication, same. Nobody moves. Patient is critical but stable. And somebody says, no, we have seen such patients really coming out of ICU safely. Oh, well, there's a contradiction in the communication. First communication, repeat, recurrent, persistence, and persevered. So I've talked about the obedient patient, emotional patient, obsessive patient, very cognitive patient, and paranoid patient. So violence against doctors can be sudden, delayed, planned, or at all those who have weak links, an isolated hospital, an isolated doctor, a very sincere, human, very kind doctor who believes in kindness may be attacked because his links are weak. And also those who have not communicated the illness, the treatment, and various stages of recovery or deterioration, and those who genuinely have been very negligent. My dear friends, 21st century, in a town, in a village, in a city, in a metro, do not underestimate the patient's awareness. Do not underestimate the awareness of the close relative. A patient who is paying 100 rupees per day for a bed, or a patient who is paying 20,000 rupees per bed is the same. And we need to tell ourselves again and again, self-talk, I have to treat them the same manner. In life, human beings see differences. माँ बाप भी कभी-कभी देखते हैं, 19-20 का फर्क बच्चों में देखते हैं. School teacher also sees differences. She may be close to some children, but she may ignore some children unconsciously, and doctors are also like that. So consciously, we need to practice emotional equity. Consciously, we need to practice communication. So that becomes part of a software all the time. And that is so, so important. So my dear friends, let me say, communication is not enough. Connection is important. Your communication has to connect. And as the president says, the people's language. Knowing many languages is an asset. But the chest thumping doctor may not really do very well. Don't worry, I'm there, my huna. My huna is not a real phrase which you can use all the time. A doctor who shows compassion periodically is a great doctor. Even if he's not able to show every day, though compassion is the heart, but he's not been able to express it, also because of conditions which is beyond his control. He's going to see 100 patients in the pandemic exam, for example, and he will not be able to show compassion because compassion fatigue will also set in. But internally, he is sincere and honest, and is doing what is right for the patient. Need for us to actually train ourselves in conflict resolution, where you can identify early signs of the patient and the relatives getting very upset and angry. You can identify early signs of you being very negligent about the patient, and you do a lot of other things to really bring the patient and the relatives inside your confidant list. So conflict resolution is not about identifying the irate patient early, identifying the angry patient early, identifying the problem giver patient relatively, identifying also my drawbacks, my negligence, my oversight, my speed. Also telling myself I'll not do angioplasty in 10 hospitals with a gap of half an hour. I don't have to. I still remember this doctor operated patient and rushed outside the OT when anesthetist said, wait, there's something happening, because he had to operate in some other hospital. Why? The patient died and he has a case on him. As President also said, that when you communicate less, you spend more time in the court. Why should you run from one place to the other? You have to complete that surgery or complete that consultation till you are satisfied that the patient is safe. Commitment is something which we all talk, but we need to remind ourselves all the time. And when I say care, not for the patient alone, self-care is one of the most important guarantees for good communication. So my dear friends, thanks for inviting me. I raised a few issues. And also what is extremely important is, as I summarize, remember, the patient will get another doctor if you are not there, but a family will not get another father, another mother. So self-care is as important or more important. And my dear friends, when there's a crisis, remember, rush, support, spend, be there, and see to it that we stand with each one of our brothers and sisters when they are in trouble, and we stand with each one of our patients when they're sick. With this, I see glorious future for the medical practitioners in the country. We need to get the good tagline for our association and for us as individuals. And we need to understand that communication is not about two individuals, it's about a system. With this, I would say, thank you, Aimee, for inviting me.
Thank you, Dr. Harish Shetty, sir. It was really exclusive talk on the communication. And truly, you have given the new dimension to the concept of the communication. Overall, the picture is that the communication is supposed to be between the two people, but you have marked it very specifically for the medical fraternity as the communication between the system and who are the visitors to the system. That's very important. And there is a very excellent take home message for each one of us across the country, that we have to really work upon the communication between us, our system, and the visitors and the patients. And definitely one more important point which has been quoted very nicely and very bluntly, I will say, that we spend crores and lakhs and hundreds and thousands on various things, and we fail definitely to train our own staff and our own people who are on the for the front line for our establishments. And this is exactly where the small and mid sector hospitals need to work upon. So let me assume that the talk by Dr. Harish Shetty, may it be a beginning for all hospitals across the country. Let us start working and building our small and mid sector establishment in this view, how we should improve our communication. I will go to my national president, sir. Is there? Jalal sir is there? Okay. Chairman, Dr. Sharad Agrawal, sir, for your kind remarks, sir.
Thank you, Dr. Mangesh, and definitely it was a very good talk and very informative, very correct, and very on the very basics, which most of us miss in our day-to-day communication. And thanks, Dr. Shetty, that you have covered the basic thing what we used to miss in our communication. And definitely we should be the pupil-centric than the patient-centric, and we should be the taking the word as a word, not as a just hospital and the clinic. I think everybody is must be benefited by this talk, and we, Dr. Pate, we must organize these kind of these series should be started rather than a one-off talk. And if we can do this, then we'll discuss and we'll start a series on the communication skills, because one talk cannot be the sufficient. And thank you, Dr. Shetty. Thank you very much.
I think the national president must be busy in organizing certain meetings at headquarters. Any questions for our friends in the audience? Any questions for Dr. Shetty?
Dr. Meenal Chauhan has raised her hand.
Yeah. Dr. Meena, you can ask, you are unmute now.
Yes, sir. Firstly, I would like to congratulate him on a very excellent presentation which he's given, and I would also want to thank you, IMA, for. And I completely agree with sir that these series have to be on a continuous basis, and a single lecture will not do justice. And most of us, especially the freelancers all around, we really need to learn these soft skills, because I think a lot of communication, these soft skills are what actually make or break your career. That's what I've realized over the years. So my question to sir is that, sometimes it becomes very, very, very difficult to convince a patient or convince the relative that this case cannot be done here, or this is not the setup where it can be done. You can take the patient to somewhere else, or maybe the case cannot be, or maybe the case is a very complicated case. We don't have available facilities, ICU, etc. at this setup. What is the best way to put this across without sounding intimidating, without sounding that we don't care? Because most of the times that is where I've seen all the violence starts. So that's my question.
I think beautiful question, ma'am. Thank you. Across the time when he or she was in hospital, he or she has allied himself or herself to one nurse, to one RMO. Even if sometimes a resident doctor can connect with that patient because of the community, because of the language. And that is one way of explaining. Somebody else reinforcing your advice is also very important. That's number one. Number two, you have friends in the high order hospitals, and they are your very close friends. Sometimes when you bring them on the call and help them to actually explain to the patient, you know what, doctor has done her best, and I need to do a little more, and I will help you, and I'll do exactly, and I'll treat you exactly the way the doctor has treated. I have a little more equipment than what the doctor. I'm waiting for you, and I'm there for you. And that also reinforces. Number three, as you are talking to the close relative of the patient, you may have 3 or 4 guys around him. Remember, please observe the 3 or 4 guys around him. The guy who's very quiet in the group may be the influencer, maybe the guy who takes the medical decisions for the patient. And I always do that. And I sometimes see these people who are very quiet, and just find out, and if you find that this guy is able to influence this guy much better, it's better to make him sit down and tell him honestly, if necessary, I will send my ambulance, but this is what he needs. And if it's my patient, if it's my relative, my husband, my wife, or my children, I would have done the same. Fourth is also very important, that the fellow who has done your MRI or your investigations or your lab tests is also part of your team. Even if the lab is outside, and sometimes a different face, a different voice, a different language can convince the person than what you and I can convince them. Remember, India is not about the nuclear family, it's about the joint family. And even in our field of practice, we are not practicing alone, we are practicing many others. So use different people the way Lord Krishna used in in Mahabharata, but be alert, and that is important. Then if things go haywire, then they will say, तुमने हमको पहला क्यों नहीं बोला? हम पहले से ही वहां हम जाते थे. And then you would say, देखो ऐसा है, जब आए थे तो इतना ही था तकलीफ, और ऐसे समय पर honestly कोई भी नहीं बता सकते, और मुझे भी ऐसा हुआ तो मैं भी ये हॉस्पिटल में खुद जाऊंगा. And sometimes they go with a lot of pain and a lot of reluctance and a lot of anger. Once they are admitted there, keep the follow-up. And honestly, if you visit there, if things are better and things are going well, they will come back to you 100 times. And I always tell young practitioners, when somebody says, I want to take a second opinion, you carry the patient to your senior, and you'll find that next time the senior refers the patient to you. And also that your goodwill among the patient's relative is so strong. So use a lot of creative methods, but you as a senior practitioner will also know more creative methods in your practice, because across time you have learned a lot. Thank you for that question. Madam.
Thank you, sir. Very, very convincing answer, sir. Thank you so much.
Dr. Vijay Harlalka from Madhya Pradesh, he wants to ask.
नमस्ते सर, बहुत अच्छा टॉक लगा, बहुत अच्छा टॉक था, बहुत अच्छा इंफॉर्मेशन मिला सर. मेरा एक क्वेश्चन है सर कि गांव के पेशेंट आते हैं या शहर के मध्यम वर्गीय पेशेंट आते हैं, उन लोगों को टैकल करना बहुत मुश्किल रहता है. आपने जो भी बात करी वो कोऑपरेटिव पेशेंट या वेल लर्नड पेशेंट के लिए है. गांव के पेशेंट जो आते हैं बहुत हालत खराब हो जाती है हमारी. इवन सबको समझाने के बाद भी इतनी तकलीफ रहती है कि हम कुछ बता नहीं सकते. हमारे पास क्या है, हम स्मॉल सेटअप से 10 बेडेड, 20 बेडेड, 30 बेडेड हॉस्पिटल्स हैं, इसमें बहुत प्रॉब्लम होती है. इवन 4 जने को समझाते हैं, उसके बाद उनके बाद दूसरे 10 जने आते हैं, बहुत तकलीफ हो जाती है. इसके बारे में आप कैसे बताएंगे कि सर क्या करना चाहिए?
थैंक यू फॉर दैट क्वेश्चन सर. हम यदि आपके जगह पे होते तो 10 साल में हमारे गैंग हर एक गांव में तैयार करते, हमारे एलाइज. सर हम तो हमारे हर एक गांव में एक दो दिन हमारे लोगों को क्रिएट करेंगे, हम तैयार करेंगे. और हम यदि गांव के पास प्रैक्टिस करते तो आसपास के 100 गांव में हम हर साल एक कैंप करेंगे. और हमारा एक मिनट मेरा हुआ नहीं. ऐसे समय पर मैं नहीं समझाऊंगा उनको, क्योंकि मेरी बात नहीं मानेंगे. पर वो गांव का जो सरपंच है, गांव के उनके जो कम्युनिटी का जो लीडर है, उनके साथ मेरी दोस्ती 10 साल में पूरे नाम छा जाएगा. और मैं उनको स्पेशल फैसिलिटी दूंगा, मैं उनका उपयोग करूंगा इनको कम्युनिकेट करने के लिए. सो इन एवरी डॉक्टर्स responsibility is to create healthcare workers across the periphery of his area of influence. I, as a psychiatrist, we create mental health soldiers to explain to other patients, because I am not Shankaracharya, I am not Abdul Kalam, I am not a teacher people will listen. I will create an army of people who will come to my help during such difficult circumstances, who will explain to them in their language, देखा ये साहब ने जो कहा सही है, आपको ये करना ही पड़ेगा. And that is the job of a doctor. Never become the Amitabh Bachchan of the old Hindi movie. मैं जहां से खड़ा होता हूं वहां से लाइन शुरू होती है, गया वो दिन. Your team across different villages, and you need to cultivate that team from the first day of practice, and that I think is very important, sir.
सर नहीं ऐसा नहीं है सर. मैं 5 साल तक गया गांव में, वहां पे सब सरपंच वगैरह सब दोस्त थे, सब थे. इवन इसके बाद भी जिस दिन कोई पेशेंट को कोई प्रॉब्लम होती है वो सब अपने अगेंस्ट हो जाते हैं, कोई भी साथ में नहीं आता है. ये सबसे बड़ी तकलीफ है.
बहुत सही है सर. बट सरपंचों का भी मीटिंग अपने हॉस्पिटल में 1 साल में 2-3 बार लेना, उनको अपनी समस्याएं बताना, अकेले नहीं, आपके एरिया के जितने जो है डॉक्टर, और उनको कहना ऐसे समय पर हम नहीं समझाएंगे तो आप लोग हमारी मदद कर सकते हैं क्या. और एक बात इंपॉर्टेंट सर, एमपी हर एक स्टेट में हर एक कम्युनिटी का स्वभाव अलग अलग होता है. कुछ कम्युनिटी का सोच में ये विचार, बिकॉज ऑफ पुअर अवेयरनेस, वो आता नहीं. ट्राइबल, आई वुड से इन वन ट्राइबल कम्युनिटी वी हैव बिल्ट हेल्थ लीडर्स इन मेंटल हेल्थ for them to identify the illness. So if you build a network, it might be easy, but I understand, sir, I do not have all the answers. And with your great experience, you have a lot of answers, because every person, you have a lot of answers, and you have succeeded in so many cases. But building an army of health workers who will be there at the back call of you is important. देखिए सर, प्रैक्टिस के बाद हमारे चाहते भी बहुत लोग होते हैं, हमारे शागिर्द भी बहुत लोग होते हैं, उनका आर्मी क्रिएट करना बहुत इंपॉर्टेंट है. विजय जी, बहुत अच्छा प्रश्न. थैंक यू सर.
Thank you very much, sir. Thank
We
you.
have got 2 more questions, sir. Dr. Parthiv Sanghvi is there. Parthiv.
Yeah, thanks, Mangesh.
Yeah.
Good evening, sir. Dr. Parthiv here. Sir, a small question. You talked about the extent of communication and especially in the circumstances when complications take place. Sir, in spite of explaining everything in detail, a thorough counseling preoperatively, which goes on for around 45 minutes to an hour with the patient, relatives, etc., sometimes things don't go our way and they go awry post-operatively, and we might require ICU, etc. You said about staying with the patient. Well, I have done that on several occasions, sir. I don't leave the patient till late at night and constantly updating the relatives, etc. But sometimes it has been seen as a weakness, as if we have really done something wrong by which the patient has come into the ICU. What I want to know, sir, is where do we draw a line as far as communication and getting, very close to the relatives is concerned?
Thank you. Parthiv is a great friend of mine. I would say, in spite of all the communication, there will be patients and relatives will create a lot of ruckus. And for that, what is very important is post-crisis management of the doctor, helping the doctor get over that acute phase of trauma is very important. Helping the doctor completely through all legal means, helping the doctor to really feel better with his family and supporting the doctor across time. And every doctor will have at least one incident like this where there's a lot of suspicion, paranoia, and hostility against the doctor. A lot of hostility might be only seen privately. Some hostility might be seen on social media. Some will go to the court, to the consumer court, and some will be seen as fist blows to the doctor. I understand that in spite of all that, there will be accidents, but if you're all together, there will be no catastrophes. Let us mitigate the catastrophe and convert it into an accident and help people like Parthiv, me, or anybody in that situation. So there is no right answer for every crisis. So the question which you said, I would say, sir, I would be continuously communicating and being honest with my communication. I will be continuously documenting, and in spite of that, if there's hostility, I would say I can't help it because I cannot resolve every situation, but I will see to it that this catastrophe is not converted into an accident. I'll tell you an example. One patient went to the police station and he or she said, कि देखो यहाँ हमारा पेशेंट बुकार है, वो एक्सपायर हो गया, my partner is a physician. And then the inspector said, आता है हॉस्पिटल बंद करायचं, हाँ बंद करून टाकू हॉस्पिटल. And that police station is the station where I've conducted enough seminars for the families of police officers. Every doctor should conduct seminars for the local police. And immediately the senior officer phoned up that officer, pulled him up and said, get out of the hospital now. And nothing happened. So every doctor should genuinely conduct activities for the local police station every year once. And you need to have the name of the police officer at the tip of your tongue. Tumhara phone, utana chahiye wo. Utana chahiye wo. And then that's what actually happened. And that I think is, Parthiv, you have a lot of experience, but we cannot solve all issues. And I would be very honest and also very close to the patient. But if things go awry, I will take the help of everybody around me. Thank you, Parthiv, for that beautiful question.
Last question by Dr. Ujjwala from Bhiwandi.
Hello, sir. Good evening. Sir, one question is there. Suppose
Bola.
You recognize me, sir?
Yes.
Thank you, sir. Sir, suppose while operating or treating, suppose a mistake is done by me. I am saying mistake, not complication. As if I have said I've forgotten mop in the abdomen or in vagina, or suppose intestinal injury is done during surgeries. Whether I should honestly confess in front of patient or I should hide?
Very good question. Case by case. And if there's a mop inside and you find that this mop is inside and you have done a mistake, you need a lot of courage to say, yes, there's a mark. And a lot of honesty to say, because these accidents do happen, these mistakes do happen. And remember, see to it that your indemnity is very big. And when you share it very honestly, what happens is you feel strained, but you feel also very light. And if you lie, you have to multiply those lies by at least 100 to avoid that entire situation. So
And manageable
as
mistakes.
far as possible, be honest. And I would say honesty is the best policy. But if there's a complication which has been managed, and you feel that sharing the complication at that point of time might cause a lot of agony to the patient and the relative, you can share it at an appropriate time, much later, when things get much better. I want to say something to you, patient, my dear patient Mala, I want to say something to you. Actually, at that point of time, you know what happened was your heart rate actually fell down, and we were not sure why it fell down, but we brought you back. We did not share this information at that point of time because you were not in a state to understand that information. You were not in a state to digest that information. So honesty is the best policy, but incremental sharing of information, seeing the context is also very important.
Thank you, sir. Thank you so much.
This webinar, which is appreciated by one and all, let me inform that it is live on the Indian Medical Association headquarters Facebook page. It is also live on the YouTube channel of IMA Hospital Board of India. And this is going to last there permanently. Okay. So whatever discussions are there, let us limit it just now for this period of time. And I thank Dr. Harish Shetty. I request finally my chairman, Dr. Sharad Agrawal, sir, to deliver his last remarks.
Share your knowledge, but never share your wallet. Thank you.
Sharad.
Thank you, Dr. Shetty, for a wonderful talk, and definitely you have given the elaborated answer to every query. And thanks to everyone, all the leaders of IMA and HBI and the senior IMA members who all have joined across the country. And we are, see, these webinar or these kind of practical topics which we are organizing at the HBI platform. We need your support. We need your participation, because your participation gives us the enthusiasm, gives us the kick to organize it on a regular basis. And I must thank our secretary, Dr. Mangesh Pate Bhai. He is working so hard. He is bringing all the good speakers available for all the talks. I'm in credit. I'm in of Pate sir, David, and I'm thankful to our national president who has given us the liberty to organize these topics. And in the last, thank you, Dr. Harish Shetty, and we will be having many more, and we request you to be a part of another session also. Thank you very much.
Definitely, Dr. Sharad, I have requested already to Dr. Harish Shetty that from Hospital Board of India, we want to take up this initiative, and as suggested by him in this webinar, and there was a suggestion in the chat box also, we will take up this initiative from Hospital Board of India, and we will try and train all staff who is working in the healthcare establishment across the country. We will have a mass webinars, and I will lead, definitely we will need the help of Dr. Harish Shetty and stalwart like him. And I am at the end, I am again very thankful to Dr. Harish Shetty for his exclusive talk on very important issue on the background of the current healthcare violence. And we all doctors have got lot many things to learn from your talk. This talk is live, going to be permanently on the IMA Hospital Board of India YouTube channel and IMA headquarters Facebook page. Those who have missed it, tell them to have a look at this talk. There is lot many things. Your suggestions are most welcome to us in Hospital Board of India. Myself, my chairman, Dr. Sharad Agrawal, We are available 24/7 for any hospital in the country for any issues there. Thank you so much. Till next Friday, 9 p.m. Good night. Thank you.
Thank you. Good night.
Thank you.
Mangesh sir, congratulations.